Breast reduction surgery is a very common surgery in my practice, and a lot of young women, even older women, will come to get this surgery done. Now let us understand that what is the need of breast reduction. So what are the problems that a woman faces with heavy breast? So what happens is that the heavy breast will obviously affect your posture, and you have a slouched shoulder. There are deep grooves from the bra straps. The sweating problem is there under the breast creases. Even fungal infections occur because that area is always wet. The difficulty in breathing, in exercising, in obviously choosing the clothes that you desire to wear. And in general, we understand that it leads to overall somewhat low confidence and not feeling very up to yourself with heavy breasts. So obviously, this is a very popular surgery because it offers a lot of benefits from the daily struggle that you're facing with whether it is your physical comfort or it is your confidence. So now just let me walk you through the process of the surgery, the initial recovery and the long-term recovery from a breast reduction surgery. So the most common question that patients will ask is that, doctor, will I feel pain when the surgery is going on? So obviously not, because it is under anesthesia that we perform this surgery. And what about the pain immediately after surgery? That is also a common question. So you will not feel pain immediately after the surgery also, and the reason for this is that during the surgery we infiltrate local anesthetics in the breast tissue, and that takes care of the post-operative pain as well. Even during the first day after the surgery, you can walk comfortably and you will be mostly pain-free. Obviously, painkillers are given to control whatever little pain that you may have. Now, there are also drains placed in the breast when we do the surgery. Typically, these drains are removed after about 24 hours from the surgery. The stay in the facility is usually overnight, but some patients choose to stay a couple of nights before they want to go home, and that's completely fine. Now, when we talk about the follow-up periods, so typically the follow-up will happen around the 4th day or the 3rd day from your discharge from the facility, and that is important because this is the time when we rule out any infection that is going on or whether it is infection free or not. So basically we check for infection in the first follow-up visit. And this is a very, very essential part of the follow-up and you must not miss it. Generally, if you're okay in the first week, the chances of infection become very, very low. You are typically allowed to shower around the 4th or the 5th day from the surgery, and we can put waterproof dressings to help you do that more comfortably. The stitches that we do in the surgery are absorbable, so usually no stitch removal is required and the scars heal beautifully on their own. Most of the breast reduction surgery scars are very, very less noticeable when you give it sufficient time to heal, and that is about 6 months to 8 months in general. But yes, some patients may require a little longer. Patients who are not so great scar formers, they can also opt for CO2 lasers or scar reduction therapies in the following period of the surgery. Of course, this is subject to condition to what kind of scars you form. But in general, we've seen that breast reduction surgery scars heal very, very well. Usually, the patients will feel immediate relief after this surgery because the heavy weight from their chest is gone, and most of the patient will remark that I wish I would have done this earlier, and that is a very common thing that we hear from the patients. The recovery period in itself is not very tedious or challenging at all. Yes, sometimes there may be some wound healing challenges or complications, but that can be tackled in the outpatient itself, and we can even put some reinforcing stitches if we really see that a wound is not really holding up well. But these are less common. The other thing that we also want to explain to the patients that initially you may feel numbness around that area. So whether it is a vertical scar or a T-scar, now the scar type also depends on your condition, how heavy you are, what is the kind of skin that you have, whether it is loose skin or whether it is a little tight skin. And in that only we decide whether we want to go for a vertical scar or an anchor scar. But that again, whatever scar we choose, usually it heals very well. Now, there's also a question with vertical scar. Many patients ask the doctor, will there be some pouch left at the lower end of the scar? Well, in about 20% of cases, this little pouch that the vertical scar leaves, and usually this happens with very heavy breasts, we may need to do a small procedure in about 3 months' time, and we can settle that little pouch with a little tuck, which can be done under local anesthesia. So it's not really a big deal. So in general, the breast reduction surgery offers great advantages with less recovery time, and that is why most of the patients, even though average time, from their deciding about the breast reduction surgery or wanting a breast reduction surgery to them actually doing it is actually a few years. And to their surprise, they will always find that okay, this was so quick and with such less recovery time, wish we could have done that earlier. So this is a very common thing that we hear, and rightly so. It's a very gratifying surgery. When I talk from a surgeon's point of view also, patients are generally very satisfied, and through the recovery process, it's important that you stay with your surgeon, you follow up properly, regularly, and do the scar therapy or take care of your scar as recommended. I hope that this video about the breast reduction surgery, its recovery, has been useful to you, and it will help you in deciding whether you want to go for this surgery or when you want to go for this surgery, and it can clear your doubts. If you have questions regarding breast reduction, do write them to us in the comment box below, and do follow our channel SB Aesthetics and keep the notification bell on so that you get notifications for the new video. Thank you for watching.